And welcome everybody to our August Comagine Health Patient Family Partnership Hub meeting. My name is Laura Jackson. I am the Director of Community at PFCC Partners. And again, I apologize, my camera is not working, but we'll go ahead and get started. Some Zoom features you may already know, but we have the chat is available for anybody. If you'd like to participate in any of our discussions through chat, you are more than welcome to add into the chat box during our discussions, or you can private message someone by clicking on their name. I will turn on live transcript. Now it's available at the bottom of your screen on your menu. There's a CC, and that is how you turn on live transcript if you need it. And then again, during our discussions, if you'd like to come off mute and participate, we love that, and you are more than welcome to. And there's the reaction buttons also on your menu button or on your menu bar down at the bottom. You can use that to raise your hand. And I'll pass it over to Katie.
Good afternoon, everyone. Katie Frazier, and as a reminder, this is the Comagine Health mission. Together with our partners, we work to improve health and create a better healthcare system so that people and communities will flourish.
Thank you. And like I mentioned, we are with PFCC Partners. We're partnering with Comagine Health to bring you this hub. So our mission at PFCC Partners is to center the inclusive human experience of health, reinvent through radical collaboration, and be a catalyst for system transformation. Our vision is a health system transformed, one that works with people and through communities as a partner in their well-being. Our values at PFCC Partner are equity, inclusion, diversity, collaboration, and being solution focused. And this is the structure of the hubs. So a few of you are coming from existing PFACs within Comagine Health, and so coming together so that all the PFACs can work together, and all patients within Comagine Health can work together to improve healthcare. We do offer engagement opportunities for you to take surveys, do speaking, and work on projects within Comagine Health. We have PFCC events. We have our online community with our forum, skills development to help with your skills within those engagement opportunities. And I already said existing feedback. So that is the structure for the partnership hub. And our meeting agreements we like to go through before each meeting. We want to make the meeting a priority. We do open the meeting 10 minutes prior to start if you'd like to join and get all set up. We do provide rough estimate of how long we spend on each agenda items ahead of the meeting, and provide context and discussion questions if needed before the meeting. If we do have items that come up during the meeting that we might want to talk about in a following one, we use a parking lot. And like I mentioned, we use the raise hand for joining in a discussion, and you are, again, also more than welcome to use the chat for those discussions. And again, we do record these meetings and send them out with a summary after the meeting. And if anything comes up during the meeting and that you're concerned about, you can reach out to Comagine Health or PFCC Partners team members. Our agenda for today, we are going to do an introductions. Then we have Kate Elliott here joining us. And then Chris Severson is going to talk a little bit about the National Alliance Annual Forum. And our introduction question for today is beach holiday or a ski trip. I know that summer is kind of starting to wind down a little bit and people are going on vacation. So I'm curious if you are a beach person or a ski person. So I can get us started. Like I said, I'm Laura Jackson. I'm the Director of Community at PFCC Partners. And I live up in Eugene, Oregon, but our offices are down in Long Beach, California. And I'm a beach person. I don't know how to ski, but I think even if I did, I would probably still choose sitting by a beach and being in the water. That's me. Let's see, I'll go down my list here. Joan.
Well, hi, I'm Joan Gallegos, and funny you should ask that question because 2 days ago I got back from Bermuda and it was
Ooh.
very lovely. The beaches, we had a pink sand and the coral in it, and they were very lovely. But I've got to say, ski trip. I like the mountains. I'm more of a mountain person than a beach person. And the hot, humid weather wears on me. So I'd rather have it cold than that kind of hot.
That makes total sense. Thank you, Joan. Thanks for joining us. Let's go to Chris Severson.
Well, I would definitely pick beach over ski, but I am more of a mountain lake camping over beach. So lake beach, I guess, would be my answer.
That's a good way to
do not
combine
like
them.
being cold. Joan, I'm the opposite of you. Hot does not bother me.
Thank you, Chris. Chris Morgan. Oh, you're muted.
I'd have to say a mountain beach.
A mountain beach too. I like that. You guys are coming up with new ones. Thank you.
Thank you.
Thanks for joining us. Jackie.
Yeah, thank you. I'm Jackie Watson, and I'm the Quinn QIO Program Director here with Comagine Health. So thanks for having me. I think this is my first meeting I've attended with you all, so happy to be here. I'm in Boise, Idaho, and I will have to concur with the mountain lake beach as my vacation preference.
I like that. Thank you. Thanks for joining us. Welcome. Let's see here. Katie.
Hi, everyone. Katie Frazier, and I am located in Portland, Oregon. And while tropical beaches are amazing, I have to say there is nothing like the Oregon coast, especially in the summer. So I will take an hour drive and go to the Oregon coast for my beach holiday.
Agreed. Nothing like it. Thanks, Katie. Kate.
Hi, everyone. Kate Elliott. I'm the Vice President for System-Wide Quality Improvement at Comagine Health. And I'm so glad I'm in a safe space where I can admit that I don't really like the beach that much because the sand gets in your shoes, and who likes that? And I also don't want to deal with snow. And I feel like that makes you kind of, on the outs with people, but I think I'm in good company here. So I'll take a mountain lake any day. So
Yeah,
thanks for having me.
Totally an option that is very valid. And I appreciate it. Thank you. Thank you, Kate. Lisa.
Hello, everyone. I'm Lisa Hall. I'm with ESRD Network 16, which is a division of Comagine Health. And I see that a couple of our patient advisors are here, Chris Morgan from Idaho and Walt from Washington. Thank you. Yeah, I'm from Miami, so Atlantic Ocean, anywhere.
Thank you, Lisa. And Walt?
Well, I'm going to be the outs from everybody. I'm a knees in the breeze kind of guy. Me and my Harley, we go lots of places, and that don't include snow or oceans.
Nice. I like that, knees in the breeze. That's funny. Thank you, Walt. And Lindsay?
Yeah, hi everyone. It's Lindsay Galley. I'm the Vice President of Programs at PFCC Partners. I am typically located in Sacramento, California, but I'm going to make a lot of you jealous because I am in the ultimate lake, beach, mountain area right now. I'm in Mammoth, Mammoth, California. I prefer a beach holiday, but it's really nice being up here in the mountains.
I'm glad you're getting away from that Sacramento heat for a little bit.
Oh, yeah.
And just check my list here, make sure I got everybody. I think I did. All right, we'll go ahead and move on, and I'm going to leave it to Kate, who is going to talk about Comagine Health's current focus and what she sees ahead on the horizon. So Kate, go ahead and take it away.
Thanks very much. I made a little presentation for you all to kind of summarize where we are on a pretty important business development activity. So as you likely know, Comagine Health is a quality improvement network, quality improvement organization, or QuinnQIO. So we're contracted with CMS to improve care for people with Medicare. And it's a contract we have held for a long time. And it's what enables us to serve as a ESRD network, and it's pretty important part of our organizational identity and our business. And every 5 years we rebid for the contract to have the pleasure of serving as the QuinnQIO on behalf of CMS. And believe it or not, we're coming up on time to do that. Our current contract goes until November of next year, but we are expecting to respond to an RFP maybe sometime at the end of this year or early next, and we're really getting ready for that. And I want to tell you about some changes that CMS has told us about in the program, because they're pretty important to how we're going to be doing our work in the future. And also because I think the hub and hub members and patient advisors, there's an opportunity for you to play a role in how we get ready for the changes that CMS has given us and how we put our best foot forward in terms of, keeping our role as a QuinnQIO well into the future. So I'm going to try not to bore you with too many details about the contracty stuff and get as quickly as I can to where you all and your fellow hub members may fit in. But a little context is important too. So let's see if I could strike a good balance. And I'll pause every little bit to see if there are questions just to clarify anything that I'm sharing, because it's a lot that I'm trying to boil down to a little. So CMS has said they have a big vision for the QuinnQIO program. They see this next round of contract as being a big change. They want QuinnQIO organizations to be seen as the country's premier resource for quality improvement help. They want QuinnQIOs to be seen as a rapid response arm to address quality and safety issues that they might identify. And I think this is really born out of our experience during the pandemic. CMS looked to the QuinnQIOs to help nursing homes in particular who were having COVID outbreaks, help them with infection prevention and control, and support them in preventing future outbreaks. And so when a nursing home had a certain number of positive COVID cases, they would be referred to us for support. And so I think CMS saw that as a function that we could serve in the communities we work in to really rapidly respond to issues as they emerge. They want us to build the capacity of healthcare leaders and help them think about creating culture change in their organization. They want us to align with a lot of federal strategies. The federal government has been hard at work in creating different strategies around health equity or healthcare quality or addressing behavioral and mental health concerns. So there are really detailed federal plans in all of these areas. And they want to see our organizations be sort of on the ground, making these federal plans come to life. And they want us to be working in communities. They want us to work with different parts of the healthcare system on healthcare challenges and really working at the community level. So right now, Comagine Health works in a lot of different states, and you might be familiar with some of those. And CMS has let us know that they're defining the regions that their contractors will work in this next round of contracts. So they formed a really large region that you see here, Region 6. And we currently work actively as a Quinn QIO in 4 of those states. We do ESRD network work in 2 additional states, in Montana and Alaska. And then we don't have a lot of experience sort of as you go east. You know, Comagine Health has less experience or staff or expertise working in those states. But CMS has said, you know, we want to have one organization serving each of these regions. And so that's a pretty big change for organizations like ours who are trying to figure out how we would provide services across you know, a geography that spreads from Alaska to Missouri. And there's a lot of different places and geographies in between. So this is kind of a lot of detail maybe, but right now, as I mentioned, we're at Quinn QIO in 6 states. 4 of those are in this new region, and then New Mexico and Nevada are in different regions. We've been in this role as a Quinn QIO for decades in the states that we work, right? We have a long history. We have a lot of community relationships. We have a lot of experience working in these communities. We have other grants and contracts in those communities, and they mean a lot to us. And we plan to continue working in Nevada and New Mexico, and continue looking for different health system improvement opportunities to be a part of in those states. But we know that we are in a good position to submit a bid to work in Region 6. And I will show you a map of that kind of zoomed in a second. So what we're doing right now is we're getting ready for this change. We're getting ready to show to CMS that we're the people to choose in terms of working in that Region 6. We need to continue doing well in our contract work right now. We want to start aligning our work with the priorities that they've identified, which turns out are priorities of most of our communities. It's sort of the big healthcare challenges that you might imagine that they would want us working on. And we want to communicate these changes to key constituencies like our boards, like you, and engage with those key constituencies in how we think of ourselves in this program in the future. So I'm going to talk a little bit about sort of what we're doing to prepare to do this work in this region that you see shown here. And I have some ideas about how patient and family partnership hub members might be engaged in that work. But before I do, are there any questions about the program changes? I tried to not get into the details of the contract too much, but are there any questions about that before I move on? Okay, you got it. Change is coming and we're getting ready. So we're working on a strategy to be competitive and serve CMS in this region that you see here, which again stretches from Alaska to Missouri and everywhere in between. And we're listening a lot to what CMS is telling us they want for the people doing this work. And they want innovative ideas and sustainable approaches to deliver better healthcare, to improve healthcare quality, to improve patient safety. They want to focus on health equity, reducing health disparities. And, you know, if you take a look at this map, this is a lot of very rural places. And so we know that rural health and the particular needs around rural populations will be a big focus of how we implement this work. I mentioned before, they really want us to think about how we're engaging healthcare leaders and helping to develop leaders You know, as you may know, the healthcare workforce is in kind of a beleaguered state. There's a lot of workforce challenges and shortages that are making things very hard in healthcare right now. And CMS sees that organizations like ours can hopefully help healthcare leaders make their facility or their organization a great place to work. Let's keep people in the healthcare workforce who are already there, because we know we need the people who are in the workforce now, and we need more people in the workforce. And so what role can we play in helping people lead organizations where people want to work? And then how can we support data-driven, technology-enabled sort of quality improvement? How could we address workforce burden or shortages using technology and data? And what are the different innovative approaches we could bring to communities in these spaces? So we don't know what the contract's going to direct us to do, but this is some of what CMS has been talking about that feels exciting to us and like important work to be a part of. So what do we have to do to be successful in this work, right? We have to win this contract. I'll be plain, like that is very, very important to our organization. It's a substantial part of our revenue. And like I said, in 4 of these states, we have a really long history. And we have history in some of, and work in some of the other states. And it's really important to us to be the contractor that CMS picks to do this work in these communities. It's also important to us to do the work in a way that aligns with our mission and values. I think Katie showed that at the beginning of the meeting. And so we've got to sort of bring together a lot of different pieces here. We need to meet the CMS vision, what they want from their contractors, because that's how we can win the bid. We know that we need to pay attention to regional, state, and local context, right? The kinds of strategies and ideas and solutions that are going to work in Seattle, Washington, are not going to work in Helena, Montana, are not going to be applicable in Coeur d'Alene, Idaho, are not going to be the same in Denver, Colorado. And so we know that we need to create a program approach that respects and recognizes regional, local, and state context. And we need to integrate the perspectives of the community. No healthcare provider is required to work with the Quinn QIO to improve quality. No hospital has to participate in our programs. No nursing home has to call us back when we're trying to help them with infection control. We have to earn that trust and provide value to them for them to engage with us. And so what better way to do that than to talk to them? And so we engage with people on a regular basis through our programs, but something that we want to do is do a community engagement process as we're looking to the future of this work, to talk with key constituencies about the vision for the program and what did they most want and need from a quality improvement organization from their unique perspective. And I think that includes healthcare providers. I think it includes healthcare industry leaders. I think it includes community-based organizations that are serving older adults. And I think it also includes people with Medicare and their families. And specifically those that experience some of the aspects of healthcare that we work on in our contracts. So 2 come to mind: nursing home residents and their families, and also Medicare patients who are managing chronic conditions, because that's a big part of what Medicare healthcare providers need to be good at to help people stay healthy. So you might guess that that's what I'm wondering, if hub members would, what kind of role hub members might want to play in an initiative like that. I can tell you we're developing interview guides. We have a very smart program evaluation team that knows how to write interview and survey questions to get good responses and to process the sort of narrative information that we get and turn it into a set of recommendations or summary or actionable information that we can use as we plan our programs. We are going to train interviewers on how to do a good interview to get the kind of input that we need. We're going to identify people to interview. You know, this is a wide geography. There's lots of different perspectives, and we want to make sure we're reaching across different demographic or geographic or other lines to get different perspectives. We're going to conduct interviews with people and collate information and use that in how we design our program strategy. So that brings me to you all and your colleagues who maybe weren't able to join today's meeting, but are part of the hub and may be interested. If you might put a hat on for them as well. I'm curious, is this something you'd be interested in participating in? What's exciting about this? What support do you think you would need? What do you think, if you're, whether you're interested or not, what do you think we should consider when trying to when identifying interviewees, or other things that you think we should be thinking about at this point in the process? I'm gonna stop share just so I can see lots of faces. I know that was a lot of information. Would love to hear what you think.
Thank you, Kate. Any thoughts?
I think it would depend on the topics that we're discussing, and you also mentioned in the first part of the slide different sections that we were going to talk about, such as culture, change. Kind of like to know a little bit more about all that, you know, different topics that you're going to be talking about, and etc.
Yeah.
Okay. Thank you.
Thank you, Donald. Any other thoughts or interests?
While everyone's thinking, I was just curious, is this sort of activity either serving as an interviewee or conducting interviews something that hub members have a lot of experience with, or would this be new? I see Chris shaking her head no.
This is not an area that I have a lot of expertise in. And I know Nevada, we've received, on the Nevada Community Board, we've received a lot of the QIO information, but it's still something that I don't feel like I'm, 100%, I don't know, educated or literate in it.
I've got a couple of comments. I think I've seen a lot in the quality environment with CMS lately that methodology and programs are designed without considering the end users, and the end users really being the people that are directly providing the care and the people who are receiving the care. So I think it's almost like a technical expert kind of panel approach. I mean, the people that are receiving the services and the people that are directly providing them need to be involved in the interviews when designing an RFP or responding to CMS about the work you're going to do.
Yeah, that's what we're trying to get at, Lisa. So sort of to kind of speak to your comment, Chris's, if I may, the Chris's, that's kind of what we're trying to do. So this is, so I want to be clear, like, we wouldn't want to train people to go give a presentation on being a QIO. I'm not trying to do that. I think what we're trying to do is design a set of questions. So thinking about interviewing people with Medicare, for example. So figuring out how we identify, maybe through hub members, maybe a role hub members play is serving as interviewees or recruiting from people they know who might want to share their experience with healthcare. So say, for example, talk to 15 residents of nursing homes, and we'd want to maybe make sure we get someone who's part of a really large corporate nursing home, or someone who's in a really small rural community in a nursing home, or maybe we want to talk to family members of someone in a nursing home, and develop a set of questions that help us understand what are their big concerns about the quality of care that they're receiving or the quality of care that their family members receiving. And the reason we'd want to think about patient and family hub members as interviewees is because you're relatable, right? You are coming from the same perspective as the person interviewing, just like I'm asking our chief clinical officer to go out and interview 10 healthcare executives and doctors because they speak the same language. We want to know what is top of mind for people with Medicare in the communities that we serve. And we can't, this isn't going to be the only way we develop that information, but it's one way. And the other thing I would say is, if there's a point in time where the hub is looking to recruit new members, this might be an interesting way to do it. So we've talked about when we go out to talk to healthcare providers in, so for example, if we go meet with a leader at a hospital, if we have a really good conversation with them and they seem to really get it and be interested in the work that we're doing, maybe they would be a good board member in the future. And I think in the same way, you might be able to meet people who are passionate about, an area of healthcare that's important to them. And maybe they'd like to join the hub or participate in the kinds of opportunities that you all participate in through your work with Comagine Health. So it doesn't have to lead to that, but I think these are just things that we're thinking about. And I thought this group might want to think about as well.
Thanks, Kate. That was really helpful to hear and kind of like clarified a lot of the questions that I was having too. But I like the way that you're thinking about that. And at PFCC Partners, we all come to this work as people with lived experience, as patient family advisors, and find that, especially doing interviews like this, in another contract, we're currently conducting key informant interviews, and we're having another person, a patient family advisor, a person with lived experience, conducting those interviews because, just like you said, you can relate to that person more on that one-on-one level. So I appreciate that. I also wanted to add, I think, and I'll speak for the Partnership Hub members, but I think that they could be key in developing like what those questions that are going to be asked as well, and how the questions are asked in a way that would make sense to all of them if they were being interviewed as well. So I think that's another opportunity. I did want to ask if there would be any stipend or compensation available for patient family partnership hub member that would be interested in doing some of those interviews.
Yeah, you're reading my mind. So, sorry.
Oh, go ahead.
Oh, yeah, you're reading my mind for two reasons. One, yes, I plan to build that into the budget, both for people doing the interviews and for interviewees. And I also, it's budgeting season here at Comagine Health. And so we're thinking about that outside of just this particular initiative as well. I think, well, I could say a lot about this, but I won't. But yes, we're in the prime time here as we're doing budgeting to think about how we compensate people for their time and providing their experience to us, especially in these kinds of structured activities. So more on that. Yes.
Great. And yeah, for the interviewees as well. I hadn't even thought about that, but I think that's super important. I think, any place where people are sharing details about themselves, their lives, volunteering their time to do that is, I'm just excited that you're thinking that way too.
I'm definitely happy to hear from others, but I do want to kind of summarize what I'm hearing and someone tell me if you think I got it right. That providing input to the development of questions seems like something that this group and its members could definitely help with. We can provide some more details and check back on interest in terms of being an interviewer, like really get into the details of like, what would we want you to do? And how much time would it take? And what are we really asking? And that might help you decide if it's something that you might want to do or not. And then really, like, and we've talked about this in other contexts of this work as well, as maybe pairing up, or I think maybe Lindsay, you were mentioning, like, if there's a staff person who knows about the program and can speak to it generally, it might be good to partner people up, right? So that someone with a lot of expertise about the organization and what we do could be partnered with someone who maybe relates more to the interviewee, and we could, sort of have both roles represented. We've also talked in other groups about, we've thought of these as one-on-one interviews, but I'm really thinking of them as, it could be small groups, it could be a focus group, right? So we are thinking about, trying to do this in different ways. So that might also be applicable in this context as well. Oh, and that this group might be a good referral source for people to interview, depending on how we do that. So did I sort of summarize what I was hearing pretty well?
I think so. I think so. And I think including patient family partners in the hub from all the way from the beginning of coming up with ideas for questions all the way through is wonderful. And we're so glad that you all are here to do so. And it is, we have had,
I'm sorry.
oh no, I'm just saying we have had a little bit of experience actually recently with folks coming and asking the hub about panels and focus groups and all that. So it's the right time and right place, I think, for you all to come join us. Chris, go ahead.
I just wanted to say, as a brand new Medicare person, I am very interested in that someone would ask my opinion about quality and about how things are going. And I think that it's an area where I think people would gladly give information. Maybe not everyone, but I think a lot of people would.
Mm-hmm. Agreed.
I think so too. And I think, we're thinking about it too. Just a couple other thoughts. We're thinking about it too, in terms of, like, right now our contract has very specific topic areas that we work in. So for example, people with Medicare who experience chronic pain, right? Or people who are managing diabetes, hypertension, chronic kidney disease, some of these that are in our contract, I think have a really particular experience with the healthcare system. I was so moved. I know at least, Chris Morgan, you were there. I was so pleased to be part of the ESRD Network's annual meeting earlier this year, where the Patient Advisory Council came together with their other board members, and it just reminded me of the power of people who share this experience, talking about what their experience is like and the insights that can be gleaned from that. So I think we're not just, I think we're thinking about people with Medicare, but we're also thinking people who are really, have specific conditions or specific interactions with the healthcare system, that they have a lot to say and a lot to share. And we're also thinking about, how do we take referrals from people who are acquainted with our organization, but could we run a Facebook ad to find people who represent lots of different walks of life that may not necessarily be connected to our organization, because their experience might even be different still. So, I have to be careful not to make a mega project out of this, or everyone who's doing their day jobs is going to have a thought or two for me. But I think it's really important to us to get this input as we get ready to write this big proposal and set the course of our work for 5 years. So I just really appreciate this group sort of hearing it out and giving some good ideas and good feedback. It's been really helpful.
Thank you, Kate. And we've heard from other patient family partners in our other network that those topic specific things, all kinds of stuff, is something that people are interested in when they know a specific topic that they can share their experience on. So all great stuff. Look forward to it. Does anybody have any other thoughts or questions for Kate?
this is Chris, and I'll just say, let's get through this cycle with CMS until they can come back to Nevada. You guys can all come back to Nevada.
We might weasel our way into a role in Nevada, Chris. You just never know how these things shake out. That's what I say.
I just saw that map that you put up at the beginning, and I was like, oh, but Nevada is not shaded anymore. So, sorry.
I know, I hear you.
All right. Well, thank you so much for joining us today, Kate, and sharing. We really appreciate it. Did you have anything else you'd like to share with the hub?
No, I didn't. I already probably took past my time. So I was just going to hang out
good.
for the rest of your meeting, if you don't mind.
Of course. All good. Well, thank you so much. I am going to go ahead and share screen again. All right. There we go. And so speaking of opportunities, Chris Severson came to us last week with an opportunity she saw with the National Alliance annual forum, and she would like to share that with you all. So I'm just passing it off to a bunch of people today. So Chris, go ahead and take it away.
Great. Actually, so I have a day job, and my day job is that I am the CEO of Nevada Business Group on Health and Nevada Health Partners. And what we do is we represent employers in Northern Nevada, mostly self-insured, but not all. And we contract for healthcare services. We do data management. We do community education. We have a diabetes program. So we do a lot health related. Also in my other life, my second life, we belong to the National Alliance of Healthcare Purchasing Coalitions, which is like this huge, big mouthful. But I have been fortunate enough to be elected as chair of the governing board for this national association. I know Joan has heard this before, but it's a very exciting role. We've been very active in hospital price transparency, PBM reform, pharmacy reform, and a lot of different things. And if you could maybe change the next slide. We are the only nonprofit purchaser-led organization with national and regional structure dedicated to driving health and healthcare value across the country. We represent 45 million Americans with through either employers or unions or whatever, spending over $300 billion annually in healthcare. There's over 50 different coalitions in the country, and they're all different. And so we have been very active legislatively. I have met with Senator McCarthy and Pelosi and their healthcare advisors on health-related issues. There's a couple that I'm really passionate about, and one of those is that it has been my involvement in this group, in Comagine and in the patient family partnership. But I've never seen an opportunity to sort of bridge that patient gap. So I think a lot of you know me. My mom was very ill growing up, my whole life. My mom was ill. She had rheumatic fever as a child. She had heart disease. If you could get it, she got it. If you could have it, she got it. Kidney stones, gallstones, everything. And so I was very involved in the healthcare field at an early age, worked at a hospital. My sister worked at a hospital. My mom worked at a hospital and worked for doctors. So I've been around the healthcare environment for a really long time. And for me, I'm not intimidated by it, but that is so not the norm. And so one of the things that I really enjoy about the patient family hub and the advisory councils is that we get to hear from the patients and we get to talk about how to better that patient experience. One of the things early on, and I know this sounds really silly, but one of the calls we did a lot of work around ICU, like what's it like for a patient to be in ICU, and what's it like for their families when their family member is in ICU, and what happens when they come home. Another topic was working on nursing home. And if you had a parent that was going in a nursing home, what are the top 10 things that you would look for? And so for me, these are so relevant topics And so in June, I believe, Joan and I got to see Lindsay and Laura and the group and go to Los Angeles and talk about how to bring the patient voice back to healthcare. And so go forward a couple of months, if you could change slides. Go forward a couple of months, and I was in Nashville in June, and with a bunch of coalitions and a bunch of employers. And the last day was a group called the National Health Leadership Council. And they had a session on the patient voice in healthcare. First time I've ever heard it at the national level with this group. And it was interestingly, it was a panel of physicians, and they were all talking about how to bring the patient voice into healthcare. And I thought it was kind of ironic because I don't think physicians are the best people to ask always. You know, I mean, I think that these gentlemen had the best interests in mind, but I thought it was just very telling that they had no patient or family there as part of the panel. What was really gratifying was the audience just embraced this topic, totally embraced the topic. And unfortunately, it was a small group of maybe 50 people, but they really engaged in this topic and wanted to know more. And I had a couple of employers come up to me after the session because I had shared my experience with the PFAC and with you all. And they wanted to know how they could get involved or what could they do, and wanting to embrace this. So next slide. We have an annual summit in November. The leadership summit is kind of small. Our big convention, if you will, the annual summit is in November of 2023. And I'm sorry, I think I don't know why I recopied that. Is there another slide? Yeah. I submitted a proposal to the National Alliance. They asked for speaker proposals or presenters, and I submitted one. I didn't really talk to very many people before I did it. Sometimes you just have to kind of do it. So I submitted a proposal to bring the Patient Family Advisory Council concept, the history, and a voice to the broader audience in November in Washington, D.C. And my proposal included someone from Comagine, someone from PFCC, and hopefully someone from this group as a patient or family member. I'm actually on the review committee, so I'm not reviewing my own, but we are reviewing proposals, and we're meeting tomorrow to go through all of the proposals and to see what groups we want to bring to Washington in November. But I just wanted to let this group know kind of what's going on. I just think that this is a really great opportunity for us to get to a broader audience. As a former employer, so I was in the human resources benefit space for most of my life. You know who your people are that have the stories, right? We all know people that from an employer standpoint who have had really tough medical experience or unique medical experience that need to be brought to the table. And so I'm just hoping to that we get approved and that we can bring this concept to a bigger audience. So hope that makes sense.
Thank you.
Questions?
Any questions? Well, I will say, to start off, I think it's great that you saw this opportunity and thought of us here at the hub. And I think it would be a great opportunity for someone to be sharing their experiences in PFAC or just being engaged in healthcare improvement. I think is going to be awesome.
Thank you. I'll let you know what I hear.
Any other thoughts for Chris or Katie? Yes, you have your hand up.
Yeah, I just wanted to acknowledge, Chris, thank you for, capturing this opportunity and realizing, yeah, physicians might not only be the best people to discuss this with. So I'm really excited to hear the opportunity and thanks for bringing it back to the hub.
And it may come back in a different form. They may come back and say, we want to bring the patient voice, but maybe the group could look a little bit different, or, somehow they may want to have an employer voice on the panel, for example. So I'm not really sure what it's going to look like in the end, but I'm hoping that we have some sort of representation.
Absolutely. Any other thoughts or questions? All right. Well, thank you so much, Chris, for bringing that to us. We look forward to, like Lindsay says, look forward to hearing what's next and what they come back with for the proposal and see what the next steps are. Yes, fingers crossed. Well, thank you so much. And that is actually all we had for today. So if anybody has any questions about anything in general, I'll stay on for a few more moments and answer those for you or point you in the right direction. If you have anything that pops up after we log off, my email is there and you all get emails from me. But feel free to reach out with anything that you may need. Our next meeting is September 7th. So a little bit longer in between meetings this time around, since we did move our last one for 4th of July. So yeah, thank you all for joining us today. And we look forward to talking with you online and seeing you in the next meeting. Thank you.
Thank you, everyone.